And KRON 4 is continuing to focus on the fentanyl crisis. Today, San Francisco's health department updated us on the drug's continued threat to the public. KRON 4's Haaziq Madyun has new overdose numbers.
The alarming number continues to grow for fentanyl overdose deaths this year in the city of San Francisco.
This year, to date in San Francisco, almost 80% of our preliminary overdose deaths are due to fentanyl.
Last month, in our city, 53 people died of overdose. That is while that is a decrease from May, where 78 people lost their lives due to overdose, this is nonetheless higher than we saw last year.
San Francisco Department of Public Health officials describe why fentanyl is in a class by itself when it comes to addictive drugs.
Fentanyl is a game changer. It is more deadly, more addictive, and harder to recover from than other drugs that we've dealt with in the past. Due to its potency, a very, very small amount of fentanyl can kill someone.
Dr. Hillary Coonens outlines key steps DPH is taking to reduce the risk of overdose deaths.
We have trained, as well as our partners, thousands of people on how to recognize an overdose and use naloxone to save a life. We are also working to expand training in overdose recognition and response, and we are also planning to fund organizations to provide overdose prevention and outreach focused on Black and other highly impacted communities in San Francisco.
Drug prevention and treatment services may be offered to people, but the question is, are they accepting?
People are not accepting voluntary services for drug treatment.
And that is where San Francisco law enforcement now comes in as a compulsionary measure, the possibility of being arrested for using drugs in public spaces, says SF District Attorney Brooke Jenkins.
Most of the people that I encounter who are in recovery now say that it was hitting rock bottom, which was being arrested, that ultimately led them to get clean. So that's the first point. The second point is, I have no issue with having public health intervene in any manner that we believe they should. I don't think that this is a one-prong approach of simply using the criminal justice system. But to the extent that public health is unsuccessful, and when we look out at the street, apparently there are things that are not working with what's going on, I believe that my office can serve some role in this to help.
Between the help being offered for drug users by the Department of Public Health and that of San Francisco law enforcement, only time will tell if either of these options will be successful in reducing lives lost to the city's fentanyl crisis. In San Francisco, Haaziq Madyun, KRON 4 News.